Well, now I will invite Ms. Maha she will speak about HIV/AIDS in humanitarian settings.
Okay. Today we will talk about interventions as young peer educators in Jordan, how we dealt with the pressing issue of Syrian crisis and this humanitarian setting in specific. First, I will start by a brief introduction about YPeer. YPeer is a youth peer education network. It's a groundbreaking and comprehensive initiative, a youth-led initiative that has been initiated firstly by UNFPA in 2002. We, as a national network in Jordan, have joined the bigger international family in 2008. What we are focusing on is basically sexual reproductive health and rights, and we try to build our capacities and our peers' capacities in that regard. We in the network have young people from around 500 non-profit organizations and institutions from all over the world. What triggered us as young people to respond to the Syrian crisis is the high percentage of young people who emerged or who seek refuge from Syria into Jordan. As you can see in the percentage that we have, the female young people are around 25%, and the young male people are around 28%. This is among the total registered refugees who were registered by UNHCR, and the total number is around 600,000 Syrian refugees in Jordan. There are several risks that surround these young people and young women in specific in terms of living in camps, as we do have around 4 or 5 camps in Jordan, but our interventions were basically focusing on Zatari camp, which is the second largest camp in the world. It accommodates around 100,000 refugees. One of the main risks that face these young women is the early marriage. Early marriage is not a new thing to the Syrian society in general, but the percentage is getting higher because there are several risk factors surrounding young females in the camp setting. So parents think that in a way that early marriage is a way to protect their daughters, so they tend to get them married at an earlier age. So it's normal to go to the camp and see that a 16-year-old female has 2 or 3 kids. The second risk factor that triggered us is harassment. Most of young people, especially females, when they walk into the streets or in the market, they get harassed by several people, not only from their own community, but also from the surrounding communities as well. The third risk factor is a sexual exploitation, and this specific risk put them into a high, make them more vulnerable to get HIV/AIDS. So that's why we thought that we as peer educators should raise their awareness and protect them from getting HIV. What are the available services in terms of SRHI in the humanitarian setting in general in Jordan? More than 80 organizations work or provide services to these vulnerable people in camp settings and in the hosting communities, but only 3 of them provide reproductive health services. The main provider is UNFPA, United Nations Population Fund, and IRC, IFH are partners with the UNFPA. There is another center that belongs to the Ministry of Health. It's for voluntary counseling and testing. This is accessible to everyone from every nationality, but the only problem with it is that it's in the hosting communities. So people who are living in camp setting cannot benefit from the services that it provides because they cannot go out of the camp unless they do have a permission, and sometimes it's very difficult to get one. So what we did as YPeer network, we have collaborated with ASRO, which is the Arab States Regional Office of UNFPA, and we came up with an amended manual of peer education, and we called it Peer Education in Humanitarian Settings, where we focus more on the humanitarian settings and how we can deal with these specifications. And this manual had been piloted in July 2012 through a regional training of trainer. After this regional TOT, the participants had to do national TOTs for their peers, and the total number who were qualified to give training in humanitarian settings is 65 people. These 65 people then worked directly with the refugees in Zatari camp. They delivered peer education trainings, and they did some activities related to the 10 Days of Activism, which is our annual campaign. This annual campaign runs all over the world in the 48 countries where we present as YPeer, and we dedicated some of the sessions to be delivered there in the camp, so to ensure that this community, the young Syrian refugees, are being involved in our community and they are not isolated. The third intervention with the refugees themselves was a TOT, and we will talk in details about this. The peer education trainings that we ran, the total number was 4 peer education trainings where we qualified 10 Syrian young people to become peer educators. These 10 young people were then they designed and implemented initiatives for their peers in their own societies. The training of trainers in Zatari was a very specific one, and it was very unique in terms of several factors. The first one is that was the first time where we qualified trainers from the refugees, not only peer educators. The second was that it was a mix between the staff and volunteers. So we broke the barriers between them, and they managed to work more efficiently after that together. And the third point is that it was a mixture between Syrians and Jordanians. So they felt that they are one society and no one is that keeping them apart from each other. And the fourth one, and that was a very important thing for us, is that it included young and adult people together, because we usually in YP we work with people from 15 to 20 years old, but in this training we went up to 35, and that was very important in terms of sharing experiences. What we do to evaluate our interventions, we do have some evaluation techniques. We use the pre-post test to measure the impact or the percentage of increase in awareness. The second one is the trainer's evaluation, where the trainees evaluate their trainers. And the training evaluation, it's an overall evaluation to see the impact or if this training was useful, how can we amend it for the near future. And the fourth one is the trainees evaluation, where everyone is being evaluated by the trainer to make sure that he's a qualified peer educator or a qualified trainer, to ensure that when he or she comes to transfer the message for their peers, they will be qualified to do so. And then we analyze all of this, and we get a percentage at the end to measure the whole impact. As I said, that the humanitarian setting is basically a very challenging setting to deal with, especially that when it comes to young people. So some of the challenges that faced us is access to the camp, because people are not allowed to enter or exit the camp unless they do have a permission. So we had to do our trainings only through organizations. That way, and that was a positive thing for us, because we partnered with UNFPA, with IRC, IRD, and these are international NGOs. So it was a way for us to expand our network, but at the same time, it was a challenge that we had to overcome. The second challenge is the different age group, as I mentioned in the previous slide. The third one is that the Syrian society, the background or the interest of these young people who came from Syria is basically a bit different from what we're used to deal with as a Jordanian society. So it was a bit tricky for us, especially with the early marriage thing, because their interests are very different from ours. But that was something that we built on at a later stage. The fourth challenge is the follow-up and sustainability. So many people leave the camp and they get back home. They either go to Syria or they live in the hosting communities. So it's very hard to keep in touch with them. They change their mobile numbers. You don't know where do they set, because the camp setting is like tents and caravans, and you don't have street numbers or house number or anything. So it was a bit hard. Logistics. One major issue was the electricity with this logistical preparations, because there is no constant electricity in the camp, so it was very hard to do long training, long days of that training. And the last challenge was that reproductive health in general was not at was not very exciting for them, or it's not on their priorities or the list of priorities, because refugees usually they tend to to look for the basic stuff they need, like food, safety, security, water, and all of this, and they try to find jobs more than spending their time in building their capacities, or more than trying to get involved in the trainings that are going on. Lastly, we will talk about the way forward. After this whole trainings that we've delivered during 2012 and 2013 and 14, there were some recommendations from the trainers who delivered these trainings on the ground. There were suggestions to do similar trainings and activities more often. So we could, because that was an effective and interactive way to deliver awareness messages regarding reproductive health. And the second is advocating on different levels for the provision of relevant services. These relevant services has to deal with the HIV prevention. Establishing youth-friendly spaces that are accessible, safe, and free of charge. And this will be a very good place for young people where they can mingle and gather together. And lastly, exploring potential collaboration between different actors, just like we did with the different UN agencies, governmental bodies, and international and national NGOs. And that's it. This is how we can be reached. And I've got some posters for Pierre if you'd like to know more about what we're doing. And thank you.
Thank you so much for this wonderful presentation. I'm very delighted to have young women and young girls on my panel, and those who are working for young women.